Hello! This video will empower a quick review of the most common degenerative joint disease disorders. Please sit back and listen to the short review of the effects of rheumatoid arthritis. The peak age of onset is between 40 to 60 years, 75% of which are women. Rheumatoid arthritis is an autoimmune disease, which means that the immune system malfunctions and attacks the body instead of intruders. It can cause inflammation, swelling, and pain in several joints at once. The spine and joints can lose function from bone and structural changes. The 4 stages of rheumatoid arthritis are known as Stage 1, synovitis. During Stage 1, you may start having mild symptoms, including joint pain and joint stiffness. Stage 2, pannus. Pannus is a type of extra growth in your joints that can cause pain, swelling, and damage to your bones and cartilage. Stage 3, fibrous ankylosis. Ankylosis is a term for when bones start to fuse together at a joint. Stage 4, bony ankylosis. As the name suggests, Stage 4 is when the bones fuse together with actual bone tissue instead of just a connective fibrous tissue. At this stage, pain actually goes away, but so does the ability to move. An example of this would be back pain for 3 months with limited movement. What is the diagnostic exam for RA? Answer: X-ray of the affected extremities. What is the diagnostic lab for RA? Answer: C-reactive protein and rheumatoid factor. How about the initial treatment for RA? The initial treatment is conservative with the use of ibuprofen. Ibuprofen is a non-steroid anti-inflammatory. In other words, it reduces inflammation and pain in the body, and it can also be used as a fever reducer. NSAIDs, salicylides, or cyclooxygenase 2 inhibitors are used for initial treatment of rheumatoid arthritis to reduce joint pain and swelling. Conservative treatment is preferred if possible. For rheumatoid-induced stiffness and swelling of the hands, a rheumatologist may prescribe low-dose methotrexate as a first-line treatment agent. It is often given with a short course of steroids, corticosteroids, to relieve any pain. The clinical presentation of RA include pain and swelling in hands and feet, or tenderness and swelling in more than one joint. Morning stiffness for 1 hour to all day. Rheumatoid nodules. Generalized fatigue that increases during flare-ups. Stress exacerbations. Loss of range of motion. Now pause the video. Can you find links to the clinical symptoms in the diagram? A neurovascular or 6Ps assessment would include pain. Note the location, onset, amount, frequency, and type of pain. 2. Pallor, the pale appearance of the skin, nail beds, and mucous membranes. 3. Pulses. Feel the distal pulses of affected extremities. 4. Paresthesia, any pins and needles, tingling or numbness present. 5. Poikilothermia, the decreased ability to regulate temperature of the affected extremity. Patients with this syndrome regulate body temperature poorly. 6. Paralysis, mobility of distal structures and muscle strength. Thank you for watching our review on rheumatoid arthritis.